Hello students. In today's video, we will discuss physiology and pharmacology of progesterone and progestins. We will study natural and synthetic derivatives of progesterone, their classification, regulation of progesterone secretion by ovaries, physiological and pharmacological actions of progesterone and progestins, uses and adverse effects. Now, progesterone is an endogenous steroidal hormone. 10 to 20 milligram per day of progesterone is released in women from corpus luteum in the ovary. Around 1 to 5 milligram of progesterone is produced in men from adrenal glands and testes. However, its function in men is not known. So, progesterone is produced primarily by corpus luteum in the body of a woman. Now, as we all know, endometrium is the innermost lining of the uterus. Now, estrogen proliferates endometrium and progesterone converts estrogen primed endometrium to secretory, and thus it maintains pregnancy. Now, progesterone is an agonist of progesterone receptors, and it's primarily known as a pregnancy hormone in the females. Now, progesterone is rapidly metabolized in the liver and it's inactive orally, and the synthetic progesterones have been developed, and these synthetic progesterones are called as progestins. So, progestins are synthetic steroidal hormones that activate progesterone receptors similar to natural progesterone. Now, progestins are commonly used as contraceptives. They are used in hormone replacement therapy and in the management of dysfunctional uterine bleeding. Now, let's see to the classification of progestins. Progestins are classified as progesterone derivatives and 19 testosterone derivatives. Now, progesterone derivatives are pure progestins. They exhibit weak anti-ovulatory action, and they are used primarily as adjuvant to estrogens in the hormone replacement therapy in post-menopausal women. Now, progesterone counteracts the risk of endometrial carcinoma that is associated with estrogen. So, estrogen is combined with the progesterone. Now, examples of progesterone derivatives are medroxyprogesterone acetate, hydroxyprogesterone caproate, then megestrol acetate. 19 testosterone derivatives are potent progestins. They exhibit potent anti-ovulatory action, and therefore they are used primarily in contraceptive pills, either alone or in combination with estrogen. Now, combined contraceptive pills, that is those containing estrogen and progesterone, are more efficacious. Now, older compounds also exhibit additional weak androgenic activity. Now, this androgenic activity is almost absent in the new compounds. Now, examples of older 19 testosterone derivatives are norethindrone, levonorgestrel, linastrenol, allylastrenol, whereas newer compounds are desogastrel, norgastimate, gastrodine. So, this is a classification of progestins. Now, before discussing regulation of secretion of progesterone from the ovaries, let's first review in brief concept of reproductive cycle or menstrual cycle. Now, this is a chart that shows one menstrual cycle or one female reproductive cycle. Now, look at the figure 1. Now, this figure shows the ovarian cycle. Now, each reproductive cycle is of around 28 days. Now, starting from the day 1 to the day 28. Now, the first half of the reproductive cycle is termed as the follicular phase, whereas the second half is termed as the luteal phase. Now, as we all know, ovary consists of immature ovarian follicles, and around one follicle develop each month. Now, this follicle is called as a dominant follicle, and this dominant follicle, it develops during the follicular phase. It develops from the day 1 to the day 14, and for the development of this ovarian follicle, it requires follicle stimulating hormone. Now on the day 14th, this ovarian follicle, it gets ruptured under the influence of luteinizing hormone, and this ruptured follicle, it releases the mature egg, and this mature egg is released in the fallopian tube. Now this ruptured follicle, it gets transformed into the corpus luteum, and the corpus luteum produces large amount of progesterone and comparatively small amount of estrogen. So progesterone is produced only during the second half of reproductive cycle, that is during the luteal phase. Now this is a figure 4. It shows the blood levels of progesterone. Levels of progesterone are here shown in the red color. Now see that during the follicular phase, during the first half of the reproductive cycle, there is no production of progesterone. It is only after the formation of corpus luteum the progesterone is produced. Now if the egg is not fertilized, then the progesterone level again fall, and this marks the beginning of a new reproductive cycle or a new menstrual cycle. Now look at the figure 1. These are the developing follicle. Now very important to remember that these developing ovarian follicle, they produce estrogen. Now look at this figure 3. This figure 3 shows the innermost lining of the wall of uterus, that is termed as the endometrium. Now estrogen is responsible for the proliferation of this endometrium, and so this endometrium, it proliferates in the presence of estrogen. Now progesterone brings about secretory changes in this endometrium, and therefore this endometrium is termed as to be the secretory endometrium. And apart from this, or as we have already discussed, that follicle stimulating hormone is required for the development of ovarian follicle, whereas luteinizing hormone is primarily responsible for the rupture of ovarian follicle and the release of the mature egg. So now let's further discuss the regulation of secretion of progesterone from the ovary. Now let's study regulation of progesterone secretion from the ovaries, and its regulation by hypothalamic pituitary ovarian axis. Now look at this chart. Now hypothalamus produces gonadotropin releasing hormone that stimulates anterior pituitary to produce gonadotropins, namely follicle stimulating hormone, that is FSH, and luteinizing hormone, that is LH. Now both these hormones, they act upon ovary. Now follicle stimulating hormone primarily regulates development of ovarian follicle, and as discussed earlier, a developing follicle releases estrogen. Now moderately elevated estrogen inhibits anterior pituitary, inhibiting the release of FSH and LH. But as the developing follicle continuously releases estrogen, estrogen levels rise, and high estrogen levels trigger a rise in FSH and surge of LH. Now this increased LH or the surge of LH is responsible for the rupture of mature ovarian follicle and the release of egg, and the process is called as ovulation. Now this ruptured follicle, it develops into corpus luteum. Now corpus luteum produces high levels of progesterone and comparatively low levels of estrogen. Now if the released mature egg is not fertilized, this progesterone, it sends negative feedback signal to the hypothalamus, which in turn inhibit anterior pituitary and further reduce secretion of FSH and LH, and this further reduces blood levels of progesterone. Now look at this diagram. This diagram depicts release of progesterone during one reproductive cycle. Now no progesterone is produced in the first half of the reproductive cycle. On day 14th, ovulation takes place, and ruptured follicle develops into corpus luteum. Corpus luteum then starts producing progesterone, and if egg is not fertilized, then progesterone level again falls. It falls by the day 28th, and this again marks the beginning of a new reproductive cycle. So after the regulation of progesterone secretion, let's study physiological actions of progesterone. Now, talking about the physiological actions of progesterone, primary function of progesterone is to prepare the uterus for implantation of embryo or for the implantation of fertilized egg or fertilized gamete and maintenance of pregnancy. Now, let's first see the effect of progesterone on uterus. Now, as already seen, progesterone makes the endometrium secretory. So progesterone brings about secretory changes in the estrogen primed endometrium. So progesterone significantly increase vascularization, and thus it increases blood flow to the endometrium. Further, the endometrial glands increase their secretion, and that causes a tortuosity of endometrial glands. Now, if egg is not fertilized, there is no implantation. So, if no implantation occurs, progesterone levels fall, and this results in the menstruation. That is breakdown of proliferated endometrial tissue and breakdown of spiral arteries, and thus endometrial tissue and blood is passed from the uterus as menstrual flow. However, if egg is fertilized and if the implantation occurs, then progesterone levels they remain elevated, and which decreases contractility of myometrium and further maintains the pregnancy. Now, further, cervical secretion becomes viscid, that means it becomes very thick, scanty, and thus prevent sperm penetration. That is, cervical secretion becomes hostile to the sperm penetration. Now, progesterone also causes proliferation of acini in the mammary glands, and the main function of these acini is to secrete milk during pregnancy. So, progesterone prepares the breast for lactation. Now, high levels of progesterone during pregnancy cause sedation. Now, apart from this, progesterone also slightly increase body temperature, around 0.5 degree rise in body temperature, and this is seen during the second half of the reproductive cycle, that is during the luteal phase. Now, another effect of progesterone is on respiration. Now, progesterone stimulates respiration as seen during pregnancy. Now, effect of progesterone on metabolism. Now, 19-nor testosterone derivatives of progesterone impair glucose tolerance, and they also tend to raise LDL, that is, they tend to raise bad cholesterol, and reduce HDL, that is, they reduce good cholesterol levels, thereby leading to the risk of cardiovascular diseases. Now, progesterone also affects hypothalamic pituitary gonadal axis. This we have already discussed. Now, progesterone secretion is regulated by hypothalamic pituitary gonadal axis. Now, corpus, as discussed earlier, corpus luteum produces progesterone, and if egg is not fertilized, then progesterone itself exerts negative feedback effect at the hypothalamus, and blood levels of progesterone fall. Now, progestins, specifically 19-nor testosterone derivatives, when administered during the follicular phase, that is administered during development of ovarian follicle, suppress pre-ovulatory rise in luteinizing hormone, and thereby they prevent ovulation. And thus 19-nor testosterone derivatives markedly suppress gonadotropin releasing hormone, and these are potent anti-ovulatory agents, and therefore they are used as oral contraceptives either alone or in combination with estrogens. Now, after discussing physiological actions of progesterone, let's talk about the uses or indications of progesterone. Now, first uses as contraceptive. Now, 19-nor testosterone derivatives are potent progestins, and they are used primarily in contraceptive pills, either alone or in combination with estrogen. Now, secondly, Progestins are also a very important component of hormone replacement therapy. Now, in non-hysterectomized post-menopausal women with uterus, progestin is supplemented with estrogen therapy to counteract the risk of endometrial carcinoma caused by estrogen. Now, progestins are also useful in the management of dysfunctional uterine bleeding. Now, in patients with an ovular cycle, that is cycle where ovulation does not take place, treatment with the progestin supplemented with the estrogen regularizes and normalizes the menstrual flow. Now, progestins are also useful in the treatment of endometriosis. Now, endometriosis is a disease in which tissue that lines the uterus, that is endometrium, also grows outside the uterus, which is termed as ectopic mass. Now, progestin treatment causes regression of ectopic masses. Now, progestins are also useful in the treatment of threatened or habitual abortions which are caused due to the deficiency of progesterone. And apart from this, progesterone is indicated as a palliative therapy in the management of endometrial carcinoma. So these are some of the main uses of progesterone. Now let's talk about the adverse effects of progestins. Now talking about the side effects or adverse effects of progestins. Now, long-term administration of progestins can cause breast engorgement. That is, the breast tissue swells and that causes pain and tenderness. Progestins can also cause headache, irritability and mood swings. They can cause irregular bleeding or amenorrhea. 19 testosterone derivatives, they reduce high density lipids, they reduce good cholesterol, and they increase the risk of cardiovascular diseases. Now, long-term administration of progestins can also cause breast cancer. Now, these progestins, they can cause masculization of female fetus, and they can also produce congenital abnormalities if they are given in pregnancy. And these progestins, they are found to promote or increase the weight, and levonorgestrel is found to increase the blood sugar, and it can also precipitate diabetes. So this is in brief on physiology and pharmacology of progesterone and its synthetic derivatives, that is progestins. If you find the video useful, kindly like, subscribe and share this video. Thanks for watching this video.